Hey guys, welcome to my channel, Hairlicious. If you guys are new, please make sure to subscribe so that you guys are updated on my second hair transplant journey progress, as well as video topics covering current hair loss treatments. Visit my website at hairliciously.com to purchase your microneedling devices and dermal rollers, both which are scientifically proven to stimulate hair growth, my low-level laser therapy cap, hair growth supplements, DHT blocking shampoo and serum, and a few other products that can help for those who are suffering from hair loss. I also have a 20% promotion going on if you guys use the promo code 20 discount now, which is valid until tonight. So please make sure to take advantage of that. So today I kind of wanted to discuss about oral minoxidil again for the treatment of androgenic alopecia. I've covered this topic not too long ago, but I actually came across another post on the hair loss forum, Hair Loss Talk, regarding a guy that goes by the username Grim, and he's actually shared some pretty incredible results of hair growth on his left temple after taking oral minoxidil. Now, according to his post, he's been taking 10 milligrams of oral minoxidil tablets for the past few months. Before, he was using topical minoxidil, but he didn't see any results, and he decided to take oral minoxidil. And about 9 months in of taking it, he started seeing some pretty crazy hair growth on his temples, which I think is just amazing considering that this is all solely from oral minoxidil. He also added that taking oral minoxidil has also helped him regrow a lot of his hair back due to retrograde alopecia, which is a form of hair loss that affects the lower portion of the neck called the nape, as well as some of the sides on the scalp right above the ears. This is something that I've also suffered from, particularly the sides where it's very thin. And today there's not a lot of information as far as treatments are concerned. So what I do is I try to keep the sides short whenever I cut my hair so that it kind of disguises the fact that it's thinning. But anyway, there's not a whole lot of research or scientific studies on oral minoxidil for the treatment of androgenic alopecia. But there's a compelling study that I did find from August 2019 by Spanish scientists that looked into the effectiveness and safety of low-dose oral minoxidil in males suffering from genetic hair loss. Now, previously, there were a few studies on low dosage of oral minoxidil that has been successful in female hair loss, but the study states 2.5 or 5 milligrams of oral minoxidil was given daily for a minimum of 6 months in a total of 41 men between the ages of 20 and 55. A lot of men in this group were already taking other means of treatment, such as dutasteride, oral finasteride, topical minoxidil, topical finasteride, for an average of 18 months, and they were not good responders to treatment. Clinical improvement was observed in over 90%, yes, 90% of patients, and none of them had conditions that worsened, which means that oral minoxidil has some pretty high efficacy in stabilizing hair loss for the majority of users. Now, side effects were also minimal, with 2 patients suffering from edema and 1 patient who underwent hair shedding. Now, here's a photo of a 28-year-old who was suffering from androgenic alopecia as a normal 2 and has seen marked improvement after 3 months of treatment using 5 milligram oral minoxidil in monotherapy. You guys can definitely see improvement to the hair quality itself, as well as crown density improvement and even the mid-scalp. The hairs also look so much healthier than it previously did. Now, this further concludes with the fact that the study's retrospective design and low number of patients are obviously the limitations that would need to warrant further studies for a more definite and conclusive evaluation. But there's no doubt that oral minoxidil is indeed effective, if not, even more effective than topical minoxidil at treating androgenic alopecia, and is presented as an acceptable safety profile for males. The optimum dose would need to be delineated in future controlled studies. Now, oral minoxidil isn't really prescribed as a treatment for androgenic alopecia because it was originally intended to treat hypertension. After observing that one of the reported side effects was hair growth, it was later used as a topical to treat hair loss under the trademark Rogaine. The mechanisms by which minoxidil promotes hair growth is still not fully understood, but researchers confirm that it acts as a potassium channel opener, and theoretically it helps widen the blood vessels and opening potassium channels to allow the nutrients and oxygen in blood to the scalp. A lot of people who are using minoxidil undergo shedding as the hair follicles transition to the telogenic phase and then eventually are replaced with thicker and stronger hair in the new anagen phase. And the thing a lot of people do is after taking topical minoxidil short term, they start shedding, and this is when their fear starts kicking in because they think that they're actually losing more hair, which is not the case, because you need to be on minoxidil consistently and after a few months for the hair cycles to go back to the anagen phase where you're going to result in more thicker and stronger hair follicles. There are some studies that do possibly indicate that minoxidil also acts as an anti-androgen with significant downregulation of the 5-alpha reductase gene expression, but it's not conclusive and there's been mixed reviews as far as exactly if it's actually an anti-androgen or not. Now, I would also assume that there's a lot of doctors who would be hesitant to prescribe oral minoxidil for the treatment of hair loss, only because we already have the topical application and other FDA hair loss treatments such as oral finasteride that targets one of the root causes of genetic hair loss, which is DHD. Taking oral minoxidil would be an off-label medication since it's not FDA approved for hair loss. But there are doctors in the US that are willing to prescribe you oral minoxidil if you guys are not a good responder to mainstream treatment. I don't personally know of any doctors since I've never asked for oral minoxidil. But if you guys look at various hair loss forums, people do get prescriptions from doctors or they get it online from various sources, which can definitely be dangerous since you don't know exactly if they're going to be counterfeit medications or not. But it's the same way with dutasteride. It's not meant to treat hair loss in the US specifically, but there's a lot of people that are using it off-label for treating androgenic alopecia because it does show better efficacy than finasteride due to its inhibition of over 90% of systemic DHT, where finasteride only inhibits about 70%. And dutasteride does have a longer half-life and compared to finasteride, and it also does inhibit both types 1 and 2 of the 5-alpha reductase enzyme. And not so surprisingly enough, Korea actually issues out dutasteride 0.5 milligram, which is FDA approved for treating hair loss, and a lot of people opt to taking dutasteride over finasteride just because of its better efficacy. But for those who are not good responders to mainstream treatment and want to look into taking oral minoxidil, you obviously want to speak to a reputable doctor, a knowledgeable doctor on the possible side effects, because one of the main side effects from taking oral minoxidil is fluid retention, which can lead to congestive heart failure. And this is why a lot of doctors who do prescribe oral minoxidil for treating hair loss usually prescribe a beta adrenergic drug and a diuretic to be taken together to reduce the side effects. One study that shows female patients combining oral minoxidil and spironolactone, which is also a powerful anti-androgen, lowers high blood pressure, and it also lowers fluid retention given that it is a diuretic, and it can actually help balance the sides from oral minoxidil. The study also further mentions that side effects were stated to be generally mild. Now, I'm going to be ending this video with an article that I found back in August of 2019 where 17 children in Spain were accidentally given oral minoxidil after a drug supplier had mixed up a heartburn medication called omeprazole with oral minoxidil, and the children ended up with werewolf syndrome, which is also known as hypertrichosis, which causes thick hairs to grow all throughout the body. But this, along with others who have posted their incredible results from taking oral minoxidil, to show how efficacious the treatment can be. And I'm currently only taking oral finasteride and topical minoxidil, but I think it may be a good alternative to check out for those who have not been good responders to other treatments. And like I said, I may look into oral minoxidil later down the road if my current hair loss regimen is not effective or loses efficacy. But I think as of now, I don't have to jump on oral minoxidil. You obviously want to consult with a doctor, like I said. Find someone who is willing to prescribe you oral minoxidil, as well as be aware that there are possible side effects that this medication can bring. But that's all I have for today, guys. If you guys like this video, make sure to give it a thumbs up, subscribe, and I will talk to you guys in my next video. Take care.